I would like to welcome everyone for attending our presentation for tonight. The topic is parenting your anxious child, what parents need to know and how they can help. So my name is Farouz Taj. I'm RN, psychiatric and mental health nurse. And I would like to invite Dr. Laurel Johnson for introduction.
Thanks, Rose. So hi, everyone. Happy to be here. My name is Dr. Laurel Johnson. I am a psychologist, a child and adolescent psychologist, and I'm the clinical director here of our child and youth and family programs here at KinArc. So really great to be doing this education session on this super important topic. I just know that anxiety is something that's very pervasive in children and adolescents and adults, to be honest. And so I'm glad that this is really well attended and that we can give you a lot of really good information to help you if you are parenting your anxious child. So thank you.
All right, so the agenda for tonight is mental health in young people, understanding anxiety, how anxiety may develop, what anxiety looks like, getting help through medication and psychotherapy. During your registration, we received your responses, and those are addressed here. However, if there is any question that may come up, please feel free to use Q&A, and we'll try to answer those questions.
All right, I'll get us started by just kind of setting the context in terms of understanding mental health in young people in general. So I don't know if we've all heard that statistic that, 1 in 5 people are going to suffer from a mental health issue in their lifetime. But it's a very pervasive statistic, and it's true. And, last week I was watching the Australian Open, and I saw this Bell Let's Talk commercial. I just put a screenshot on it there. I don't know how many of you saw this or saw it within the last little while, because Bell Let's Talk Day was yesterday on January 25th. But this commercial was so poignant to me, really caught my attention. This man is the teacher of a classroom of small students, and he went up to the door, looked in the classroom, had a panic attack, and just, collapsed there in the hallway. And he says that, quote, 1 in 4 Canadians have been experiencing high levels of anxiety. So, I mean, it's just anxiety is something, as I said, is pervasive for children, adolescents, and adults. It is something that lots of people, really are looking for relief from and help with. So when I think about how we're going to do that for people so that, your child isn't this poor teacher, having an anxiety attack before he enters his classroom. That's why you're here, right? That's why you're here, to understand how you can help your child so that they are not suffering as much. And that early intervention is really essential in preventing those serious mental health problems later in life. And it also, like, for working with children and youth, it really is a collective effort. There's so many really important people in children's lives, parents, educators, including also health professionals and community organizations. Utilizing all of those resources will be really, really helpful in supporting a child who is suffering from anxiety. So let's talk about anxiety in young people. And, it depends on the study that you look at in terms of what the prevalence of anxiety is. It's pretty accurate to be around 8% of teens, 3% if you're talking, younger kids before the age of 12 will have a diagnosed anxiety disorder. Now, that is not including those children and youth who have symptoms of anxiety. And some of those symptoms could be pretty pervasive, but they're just either haven't been diagnosed or don't meet diagnostic criteria. But so thinking about that's what the statistics are saying around that. But the other thing I really wanted to educate people on is that anxiety is actually good. Anxiety is built into our human system for a reason. And it's Like if you think back to the caveman days, okay, none of us were there, but if you think back and conceptualize what it was like for our cavemen, in order to ensure our survival so that we do exist today in today's society, they had something, and we continue to have something built into our human condition called a fight or flight response, or fight, flight, or freeze response. But that's the anxiety response. And it's really intended, one, to keep us safe, right? It keeps us safe. So that caveman hears, a noise in the tall grass and say, oh, I better get the heck out of here. It could be a tiger about to eat me. So he flights, he gets the heck out of there, or he's ready to fight, right? So having that built into our human condition has kept us alive through all these years. So anxiety is helpful. It keeps us safe, when you should be nervous about walking onto a busy street. That keeps you safe. The other thing anxiety does in optimal levels is it kickstarts us into getting stuff done, right? So, I gotta get that done. And you have that optimal level of anxiety or stress, and then you can get kickstarted into being productive. So those are kind of good things that anxiety does for us. But anxiety becomes a problem when these two conditions here are met. One, it causes a lot of distress. We don't want, you to be triggered into your anxiety response so much that's causing you so much distress, and also so much that is getting in the way of your daily functioning, your goals, and or your development. So those are the times when anxiety becomes a problem. So I often get the question from parents in terms of, well, what is kind of normative anxiety? And so these are some of the things that, the evidence would suggest are normative fears at different stages of development. So infants, it's normal for them to be afraid of loud noises, and they have a very, very strong startle response. Toddlers and young children, they're afraid normatively of imaginary creatures. They're afraid of the dark, animals, strangers. In school-age children, it's more about being fearful of injury or natural events like storms, hurricanes, earthquakes, death. That's normal for school-age children to be fearful of. And then for older children and teens, it's more around school performance, being competent in their social environment, as well as their health. So, this is not an exhaustive list. So I put these cues here for parents to really kind of help them determine whether or not the anxiety that they're seeing in their child is normative and or age appropriate. So ask yourself, is this fear rational or is it irrational? Is there a recognizable trigger? Because if there's not a recognizable trigger, then that could be problematic. Is it bearable? Is it something you can actually manage? If my child can manage that fear, I'm not going to pathologize something that doesn't need pathologizing, right? So that's another question. Is it persistent or is it transient? Those are other questions that you want to ask yourself. And does it lead to avoidance or withdrawal inappropriately? So this is the key when you're thinking, is it getting in the way of functioning, expectations, goals, right? Because your child is fearful and then wanting to either withdraw or avoid things that they shouldn't be avoiding. So those are the questions that are really helpful for parents to help determine whether or not what they're seeing in their child is something they should be concerned about.
All right, so how do anxiety disorders develop? The development of anxiety is determined by complex interactions among a variety of factors. First, developmental factors. It's really a temperament style of a kid. Usually it's present from an early age. A kid may be hypervigilant, excessive worrying. And if you look at from infancy, if they have those kind of distress reaction, then they may tend to have those as a toddler or as a child. And then genetic factors. Children of parents with anxiety disorders are at an increased risk of developing an anxiety disorder themselves. And then social environmental factors, parenting styles, and learned behavior. Parenting styles are critical environmental factors in the development of children's anxiety disorder. Anxious, overprotective, or overly critical parenting behaviors can contribute to the development of pathological anxiety in children. Child maltreatment, such as abusive or neglectful parenting behaviors, have been found to be linked to anxiety disorders, particularly to social anxiety disorder in childhood and adulthood. Learned behavior. Children learn anxious and fearful responses from their environment in at least 3 ways. First, direct negative experiences. For example, being bitten by a dog leads to a fear of dogs. Second, false alarms, perceiving a situation negatively, such as school performance, without direct evidence supporting this belief. Three, vicariously, witnessing or being told something is dangerous. So children who observe their parents modeling fearful responses to a stimulus or situation, for example, spiders, are more likely to respond in a similar way. Children also learn to cope with anxiety through avoidance after observing that parenting anxiety is reduced by their own avoidant behaviors or by experiencing a decrease in their own discomfort as a result of avoidance, which is negative reinforcement. Anxiety presents itself in many different ways. There are some common anxiety symptoms that may present a little bit different than adults. So, for example, pain like stomach aches and headaches. They may have trouble getting to sleep because there may be worry thoughts that's coming up. Now it's time to kind of relax and everyone is going to bed. That's an opportunity for the kid now to for their worry to pop in, and they may have a hard time kind of processing that, and that's getting in the way of them sleeping. The desire to control people and events, feeling agitated or angry, avoiding activities or events, including school, because those activities may, you know, show them or show some physical symptoms that actually may, you know, tell them that anxiety is actually dangerous. And then intolerance or uncertainty, feeling worried about situations or events, over planning for situations and events. And there is also what if questions some kids may ask, you know, thinking or being more in the future rather than being in the present. So how can you help your child to go from what if to what is? So kids may, when they think about what if questions, they may think like, what if my locker does not work? I miss class. What if Susie doesn't talk to me or doesn't eat lunch with me? So things like that. One way to help your child to move from what if to what is kind of bringing them back to the present moment is you know, breathing with them for a few minutes. That will really activate the rational or wise mind, and really helps them to kind of problem solve that in a calmer manner. Excessive need for reassurance. Dr. Laura Johnson will talk about this more. So kids may seek reassurance excessively to kind of deal with their anxiety, and they may have those physical symptoms they want to relieve from. So there is a purpose that's served from that. Getting help for mental health difficulties. Support can be obtained through a family physician. They have access to a wide variety of resources. They may have within their clinic social workers, maybe psychologists, or they may treat or offer support by themselves if the anxiety is mild to moderate. There is also community mental health organizations such as KNARC, and there are some groups, Triple P Parenting Group, Emotion Regulation Group, Anxiety Group, and then more specialized individual assessment and intervention. In school, a counselor, a social worker, nurse, or teacher may be able to provide advice and practical support. And then on a private basis, psychologists, psychiatrists, social workers They offer assessment, evidence-based intervention, and medication. Medication. First-line medication treatment is called SSRI, or selective serotonin reuptake inhibitor. And then we have the second, which is the SNRI, or serotonin norepinephrine reuptake inhibitors. And the third line is tricyclic antidepressants. So the first line is SSRI. That's always going to be the first one to be tried, because there is a lot of research and evidence that the SSRIs are effective and it has less side effect compared to, for example, tricyclic antidepressants. So SSRI includes escitalopram, fluoxetine, fluoxamine, paroxetine, and sertraline. 3 from that list are commonly prescribed for age 6 plus. So they're fluoxetine, sertraline, and fluoxamine. What to know about medication? I think that's very important, because if your child is at the stage where now they need to be prescribed medication, I think it's crucial to understand about the medication. So risk and benefits are discussed with both parents and child before initiating treatment. Administration, usually these SSRIs are started at the lowest dose, because kids are very sensitive to these medications. So it's always going to be from the lowest available dose, and to mitigate any side effects or adverse event that may be arising from. And then dose can be increased incrementally if tolerated well after 1 week, and then between 6 and 8 weeks. If there is improvement, that's great. And if there is no improvement, then the medication is increased a little bit, given that the child is continue to tolerate. Or if the side effect is such that they're not able to tolerate, then another medication from that list of SSRI is tried. Adverse effects. There is adverse effect to the SSRI, both through psychiatric adverse effects or side effects and physical symptoms. So psychiatric side effects are disinhibition, agitation, and worsening of anxiety symptoms. So basically, the medication is doing the opposite what's intended for. And then the physical side effects are headaches, stomach upset, and sleep problems. So some of these side effects are very mild, and they will tend to show up at the very beginning of therapy. And for example, headaches, stomach upset, they may, and as the body adjusts to it, these side effects are expected to subside. And if they continue to be to the point, for example, the kid is now not able to sleep, then that's an undesirable side effect, and parents should consult with their prescriber, because continuing for a kid to continue to experience these side effects, this will be an aversive experience for them in terms of medication. They may not take medication in the future. So really being mindful of those side effects at the beginning. But as I said, at the beginning, some mild side effects are expected. And then as the body adjusts to it, it will subside.
So Feroz is a nurse, so he knows all about medication. I do not, so I won't speak to that. What I am good at doing is telling parents what not to do. Feroz talked a little bit about why anxiety disorders developed. And in my practice, whenever I'm faced with an anxious child and I see the child and their parents come in, I always ask the parents, which one of you is the anxious one? And I say that question very purposely. I structure it as which one is it versus it's just one of you suffer from anxiety, because pretty much 9.5 times out of 10, I get a taker, because as Feroz spoke about, not only is anxiety highly heritable, but it's a learned behavior because they are learning it from their environment, and the people who are most important and close to them are their parents. So that also being said, it's really important for parents to know what they shouldn't be doing that may be unhelpful for their children with their anxiety. So I'm going to go through each of these in turn, but the first one is providing too much reassurance. The next one is allowing avoidance. And then the third one is applying guilt or shame. So let me go through each of those in turn so I can give you some more information about each of them. So too much reassurance. So I mean, you are all loving and caring parents. It's a natural parental response for you to want to reassure your child when they are in distress because they're looking to you for security. So you'll say things like, it's okay, you'll be fine, there's nothing to worry about, right? So those are all natural responses, but they're problematic when the anxiety is not rational, when there's no known trigger, there is no danger. And so we have to kind of break through that. We know that children with anxiety ask for reassurance far more than children without anxiety. So they're asking, is this going to be okay? Or what if this happens? And they want to be like what Feroz mentioned, the what if questions, like, well, what if this? And what if you're late? And what if I can't find you? And what if that, there's a lot of what if questions. They're asking for your reassurance that these things are not going to happen. Right. So what's the problem with reassurance? It offers temporary relief, right? And so, yes, you say it's all fine, it's gonna be okay. Okay, I'm fine. But it's just temporary, and you'll know it's temporary because they keep asking and they keep wanting more and more reassurance. So it's not solving the issue. It's only a temporary relief. The child learns that it reduces their anxiety in the moment. So they're like, okay, well, that's good. That works for me. I feel better. So they learn that as a strategy that's effective, and that just creates this vicious cycle, and it's you're unintentionally reinforcing a problematic behavior. But it also teaches the child that worrying thoughts we must attend to them. They're important. So we're going to attend to them, right? And so it's giving that message that, yes, I'm going to attend to this. I'm going to make sure you know that everything is okay. Everything will be fine. There's nothing to worry about. It's actually also giving attention to the issue where they're learning that, okay, I guess this is valid, right? A danger does exist here. So those are the reasons why too much reassurance is problematic. The next thing is super crucial. So allowing avoidance. So one of the main, not the all the time and the only one, but a very common presentation of anxiety or behavioral response to anxiety or the fear of something is to avoid it, right? So kids are fearful of school. They want to avoid school. They don't want to go to school. They're fearful of social interaction. So they'll avoid social interaction, or even just little things like they're fearful of dogs. So I'm going to avoid dogs at all costs, right? So when you allow that avoidance, it perpetuates the anxiety. And I'm going to talk about why that is. So again, this is called the cycle of anxiety. So something happens. Let's take the dog example. You see a dog, you're fearful of dogs, you have an anxiety reaction. You're like, okay, and then you get away from the dog, you avoid the dog. When you do that, you're like, okay, I feel better. There's no dog around me. And when you think you feel better, you do feel better. You've learned that worked. I feel bad. That's what you want. You want relief from your distress. So again, it's this short-term relief, but you're not actually solving any real problems because dogs are not going to be obliterated from the face of this earth. So you're actually going to have some more long-term anxiety growth. For all the reasons I talked even about before, that you're reinforcing a problematic behavior. So the hallmark treatment, psychotherapy treatment, is exposures. And I'm going to talk a little bit more about that, but this is setting the stage as to why that works, right? So we cannot allow avoidance. You cannot save your child from the things that they're irrationally fearful of. Third one is guilt or shame. And I put this one here because this is a common method, and it's not so much with younger children, more so with older adolescents, where parents, and particularly when there's a parent who is mismatched from their child. They're not the anxious parent, so they don't understand what the child is going through. So a lot of guilt or shame, like you shouldn't be doing that. That's enough. Just getting frustrated of the anxious behavior. There's no research that supports the use of guilt or shame in changing anyone's behavior, whether it's related to an anxiety response or anything at all. And in fact, what the research talks about is all guilt or shame does is damage relationships. It damages the relationship between the person who is applying the guilt or shame and the person who is receiving it. We do know that children who experience high levels of guilt or shame, they're more likely to internalize their problems, keep their problems inside, because how dare I don't want to let anybody know because I'm going to be shamed or left to feel guilty that I'm even feeling this way. And this promotes more anxiety growth, plus low self-esteem and potentially depression later in life. And so one of the kind of key principles of behaviorism is that people will only change their own behavior when it becomes a problem for them, right? It's a problem for me, not as a problem for you. I'm not going to change my behavior for you. I might in short, like for little things or short term, but for long lasting changes, it has to come from within. So people will only change their behavior when it becomes a problem for them, or it no longer serves the function that they want it to serve. So again, but it has to be like they want to do it. They have to be internally motivated to do something different to change their behavior.
All right. What parents can do: model brave, non-anxious behavior, reward brave, non-anxious behavior, ignore behaviors that are problematic, help child to get out of fight or flight response with the acronym FEEL. So the F stands for freeze. Take a pause and do some deep breathing with your child. Deep breathing can help reverse the nervous system. And really, it brings back a child from, when the prefrontal cortex is kind of put on hold, deep breathing is actually activating that area of the brain again. So a more rational and wise mind is activated when you do the breathing. Empathize. Anxiety is scary. And your child wants to know that you get it. Really validating what's valid, and not really like Dr. Laura Johnson mentioned that yeah, you will be okay, everything is fine, but their brain is saying no, and nothing is it's not fine. For them, it's a scary experience. And then evaluate. Once your child is calm, it's time to figure out possible solutions. Let go. Let go of your guilt. You're an amazing parent, giving your child the tools to manage their worry. What parents can do, continue. So psychoeducations, you may receive psychoeducation from, let's say, met, a clinician, a physician, or social worker, what the function of anxiety is and how that's helpful. You can reinforce that to your child. What is actually real danger or rational danger, and what's false alarms. As Dr. Laura Johnson mentioned, that anxiety does have a purpose. It's actually it's good for our survival. So, for example, a car is kind of running towards you or speeding towards you. Your fight or flight response will activate to help you to get out of the way. So that's a rational response to that anxiety-provoking situation. And then there is false alarms where there may not be any danger. So kind of really understanding and sharing some information on what anxiety is will really empower your child to know about their condition.
So all like these types of strategies are things that one would learn in psychotherapy in managing anxiety. And one evidence-based treatment that is very effective at treating anxiety is cognitive behavioral therapy. So what cognitive behavioral therapy does is that it really focuses on how thoughts, feelings, and behaviors are all connected, right? So, and they're bidirectionally connected as well. And so it's not that a thought comes first and then a feeling and behavior. It could be any of them at any point of that triangle that is causing issue and it will affect the other points. So what CBT does is that it puts in strategies to target one or more of these points of the triangle. So how do we target problematic thoughts? How do we target those problematic feelings that you're feeling when you're anxious? And how do you target those problematic behaviors that happen when you're anxious? So, we're trying to identify where the problems lie, understand it, then you challenge when there's an issue, and then you look to what are the strategies for changing. So that's just kind of CBT in a nutshell. And we're going to give a little bit more details in terms of some of the things that are really helpful within a CBT therapy framework. So the first one is exposure. So I alluded to this earlier, how this is the gold standard for really targeting those anxious kids who engage in avoidance of their fearful stimulus or whatever they're afraid of. And I like to talk about neuroplasticity when I try to explain exposures and why they work. So the brain is plastic. It's always changing and developing. And so when you're learning things, neurons are firing together. And I don't know if people have heard that expression, neurons that fire together, wire together. So when you're learning something new, a new connection is made in the brain between neurons. And then the more you kind of activate that pathway, the stronger it gets, right? And then it becomes like automatic. The other law is kind of more like you don't use it, you lose it, right? So if you don't activate that pathway, it will prune. It's called pruning, but it will fade and that connection will fade. So what we're trying to do with exposures is that kids have learned that they have learned to be afraid of something and it causes an anxiety response. So I'm in a presence of a dog, then I will get an anxiety response. And that's built into their neural pathway. They have learned that. We have to get them to unlearn that. And they're not going to unlearn that by parents saying, oh, there's nothing to be afraid of. And there's, don't worry, dogs are fine. That's not going to do it. The most powerful way to retrain the brain and create new neural connections is through experience, right? So you could tell a young child, don't touch that hot stove, it's hot, you will get hurt. The moment that one time that child touches that burner and gets burned will be the only time. That is a very powerful teaching tool, is experience. So that's what we're trying to do to retrain the brain and to create new neural pathways through neuroplasticity. So when we say that you can't allow your child or to avoid, you have to expose your child to what they're fearful of so that they can create a new neural pathway that, dogs are fine. They're not going to kill me. I'm not hurt. It's not attacking me. So, eventually that neural pathway with increased experience and exposures to dogs, they'll create a new neural pathway that I'm okay around dogs. And then that old neural pathway will then prune away. So that's the way exposures work. It's really around retraining the brain to learn new responses and create new neural pathways. So that was a little bit of brain science. And how we do that is through a technique called laddering. We're not just throwing kids in front of barking dogs, right? We are building their confidence up and allowing them to experience success at small intervals and low doses at first and low levels of distress. And then you gradually work your way up to higher feared stimuli. So, step one could be, I'm just going to look at pictures of dogs. Okay, no problem. I'm good with that. Then you go to watch a video with the dog in it. Okay, I'm feeling a little anxious because I don't really like dogs, but I'm starting to feel better about that. And you keep going until you can actually get to the point where they can interact with the dog in person. So these are the kinds of things that a therapist will work on with your child around their irrational fears that they're avoiding. And it also is, so it works in 3 ways. I already talked about the new learning. You're creating new neural pathways, new learning is happening in the brain. But another reason it works is just through habituation, that you just, your emotion regulation system is not meant to be at a high level of arousal for very long, right? So your anxiety will eventually come down even if you do nothing. So you just have to ride it out and wait for it to come down. So habituation, it will just habituate and come down. But also the other mechanism for why this works is that you're also learning, or the child is learning, that they're okay. They can actually tolerate some distress. They may be feeling the distress, but they're able now to learn that I'm good at tolerating it. And that's actually what a lot of adults are doing who suffer from anxiety in their everyday lives. They're just really good at managing it and knowing that they can just tolerate it and keep being functional.
Challenging irrational thoughts through the 5 C's. The first one is go check for thought holes, or in other words, there are different names associated with this. So cognitive distortions, thinking traps, thinking mistakes. So some of the examples are jumping to conclusion, thinking the worst, black and white thinking, fortune telling, mind reading, labeling, so on and so forth. The second one is go check for thought holes. Check for what kind of thinking traps your child is falling into. Go collect evidence. Once you find a type of thinking traps or thought holes, collect evidence like an investigator or detective. Go challenge the thoughts. So one way you can do this is by helping your child to have a debate within self. Am I 100% certain about this? How bad would it actually be? What has happened before? Go change your thoughts. Be flexible in your thinking. The idea is that there may be more than one interpretation to a vague and ambiguous situation around us. So really changing that automatic thinking. Mindfulness, a simple technique that emphasizes paying attention to the present moment in an accepting and non-judgmental manner. It promotes focus and cognitive control, neuroplasticity in the prefrontal cortex that Dr. Laura Johnson alluded to. The mindfulness practice also does that. A number of studies in school setting have shown improvement in ADHD, anxiety, depression, school performance, sleep, behavior problems, eating disorders. And there are so many different ways one can practice mindfulness. So paced breathing, mindful eating, mindful dishwashing, mindful showering. And the idea is really to be present in the present moment in an accepting and non-judgmental manner. So really trying to stay away from this is stupid, not good, I don't know if this will work, why am I doing this? So really trying to staying away from that and really trying to stay non-judgmental. And if you really want to talk about your experience when you are doing mindfulness, observe and describe rather than labeling or judging the experience. So research evidence for treatment effectiveness. Children aged 7 to 17 years with anxiety much or very much showed clinical improvement after 12 weeks of treatment. So this is a little bit of a stat to share with you guys. 55% with SSRI medication only, 60% with CBT only, 81% with a combination of SSRI and CBT. I understand some parents may be a little bit on the edge. When it comes to medication, they may be thinking that, oh, my son or daughter is 6 years old or 7 years old. I'm not sure if the medication will be the right choice. Maybe there is side effects or maybe other negative experiences from the medication. It really, if the anxiety is such that a kid can manage through psychotherapy alone, and then they can participate and learn skills from psychotherapy, then I think that would be the only thing that this kid need. But if they're now in psychotherapy, the anxiety is getting in the way of participation in learning skills, and they're not learning significant skills. The anxiety is not reducing because the anxiety is so high, then there is a room for medication. Again, the SSRIs are very safe. There is a significant research on that. Again, there is some small side effect to it, but the combination of CBT and SRI will lead to significant recovery and improvement for anxiety.